Hi all, and welcome to the Paul Chandler Show. I'm your host, Paul Chandler. In tonight's topic, we're going to be discussing anxiety on the clinical side of it in a fun, animated way. So stay tuned, and we'll be right back to discuss anxiety on the clinical aspects of it. In tonight's episode, we're going to be discussing anxiety, which affects approximately 40 million Americans. We'll be looking on the clinical aspect of it. So that way, not only if you're a coder or an auditor, when you're reading the documentation, you'll be more familiar with that condition and also help you choose the words that you need if you have to possibly query the provider. So tonight we'll be talking about anxiety on the clinical aspect in a fun, animated way. Hello everyone, Captain Awesome here again. And today we're going to be discussing anxiety. Experiencing occasional anxiety is a normal part of life. However, people with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. Often, anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, known as a panic attack. These feelings of anxiety and panic interfere with daily activities, are difficult to control, are out of proportion to actual danger, and can last a long time. You may avoid places or situations to prevent these feelings. Symptoms may start during childhood or the teen years and continue into adulthood. Common anxiety signs and symptoms include feeling nervous, restless, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly, known as hyperventilation, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than present worry, having trouble sleeping, experiencing gastrointestinal or GI problems, having difficulty controlling worry, and having the urge to avoid things that trigger anxiety. Several types of anxiety disorders exist, such as agoraphobia, which is the type of anxiety disorder in which you fear and often avoid places or situations that might cause you to panic and make you feel trapped, helpless, or embarrassed. Anxiety disorder due to a medical condition includes symptoms of intense anxiety or panic that are directly caused by a physical health problem. For the generalized anxiety disorder, it includes persistent and excessive anxiety and worry about activities or events, even ordinary, routine issues. The worry is out of proportion to the actual circumstance, is difficult to control, and affects how you feel physically. It often occurs along with other anxiety disorders or depression. Panic disorders involve repeated episodes of sudden feelings of intense anxiety and fear or terror that reach a peak within minutes, known as the panic attack. You may have feelings of impending doom, shortness of breath, chest pain, or rapid fluttering or pounding heart, known as heart palpitations. These panic attacks may lead to worrying about them happening again or avoiding situations in which they've occurred. Selective mutism is a consistent failure of children to speak in certain situations, such as school, even when they can speak in other situations, such as at home with close family members. This can interfere with school, work, and social functioning. Separation anxiety disorder is a childhood disorder characterized by anxiety that's excessive for the child's development level and related to separation from parents or others who have parental roles. Social anxiety disorder, also known as social phobia, involves high levels of anxiety, fear, and avoidance of social situations due to feelings of embarrassment, self-consciousness, and concern about being judged or viewed negatively by others. Specific phobias are characterized by major anxiety when you exposed to a specific object or situation and a desire to avoid it. Phobias provoke panic attacks in some people. Substance-induced anxiety disorder is characterized by symptoms of intense anxiety or panic that are a direct result of misusing drugs, taking medications, being exposed to a toxic substance, or withdrawal from drugs. Other specific anxiety disorders and unspecified anxiety disorder are terms for anxiety or phobias that do not meet the exact criteria for any other anxiety disorders, but are significant enough to be distressing and disruptive. Examples of medical problems that can be linked to anxiety include heart disease, diabetes, thyroid problems such as hyperthyroidism, respiratory disorders such as chronic obstructive pulmonary disease or COPD, and asthma, drug misuse or withdrawal from alcohol, anti-anxiety medications, and other medications, chronic pain or irritable bowel syndrome, and rare tumors that produce certain fight or flight hormones. And another issue is that sometimes anxiety can be a side effect of certain medications. There are several risk factors that may increase your risk of developing an anxiety disorder, such as trauma, stress due to illness, stress buildup, personality, other mental health disorders, having blood relatives with an anxiety disorder, and finally drugs or alcohol. Having an anxiety disorder does more than make you worry. It can also lead to or worsen other mental and physical conditions, such as depression or other mental health disorders, substance abuse and substance misuse, trouble sleeping or insomnia, digestive or bowel problems, headache or chronic pain, social isolation, problems functioning at work or school, poor quality of life, and suicide. Now, while there's no way to predict for certain what will cause someone to develop an anxiety disorder, but you can take steps to reduce the impacts of symptoms if you're anxious, such as get help early, stay active, and avoid alcohol or drug use. And that's all the time we have today on our topic of anxiety. Back to you, Paul, at the Paul Chandler Show studio. I want to thank you for watching that education moment on anxiety. Tonight's episode of the Paul Chandler Show was brought to you by Clear Physician Services. Again, thank you for watching and have an awesome rest of your night. If you like this video and want to see more, make sure that you subscribe to our YouTube channel. It's so easy. It's right there. A little button. Just push it. Subscribe. I got all night. Nothing else to do. Just subscribe.